Hey, welcome to Sketchy EBM. My name is Anthony Crocco, and in today's video we're talking about the SBAR Plus tool. Now you may have heard of the SBAR Plus tool already, especially from administrator types like me, and wondered why should I care about this? Well, as it turns out, when we as healthcare providers don't communicate well together, patients die. Before we talk more specifically about the SBAR Plus tool, I want to talk about another industry where communication happens to be very important, and that's the aviation industry. How would you feel about the following conversation between the co-pilot and pilot? The co-pilot says, "The aircraft is headed towards those mountains." Pilot replies, "Okay." Co-pilot then says, "The aircraft is currently flying at 4,000 meters." Pilot replies, "Okay." The co-pilot then says, "The mountains are at 4,400 meters." To which the pilot replies, "Okay." And disaster ensues. I'm sure you'll agree with me that this was not great communication. I would rather have heard the conversation go something like this. Co-pilot says, "We're going to crash into those mountains." Pilot replies, "Let's change course," and disaster is averted. Similar types of miscommunication can also occur in the healthcare industry. As it turns out, we as healthcare providers are all taught a little bit differently how to communicate with each other. Two common but very different styles of communication include telling stories or telling headlines. With storytelling, we're using more of a narrative approach to communication. We're giving details over a time frame to create an image of what's happened. Using the headlines method of communication is a little different. It involves hitting the highlights without all the details. It's more about what I need to know now. As an example, I want you to imagine a nurse who's looking after a patient who is deteriorating. The nurse is very worried that this patient is going to have a poor outcome. The nurse gets the doctor on the phone and has the following conversation. "Hello, I'm calling about a patient that was admitted last night." And the nurse goes on to describe the admission history and physical, to which the doctor replies, "Okay." The nurse then continues on with their story, describing what happened with the patient after they arrived on the floor, to which the doctor again replies, "Okay." The nurse then goes on to describe how 3 hours ago the patient began to deteriorate, and now they are worried about the patient's condition, to which the doctor again replies, "Okay." Unfortunately, in this case, the nurse is telling a story, and the doctor just wants to hear headlines. The doctor could easily misunderstand the severity of the situation and think that they have time to finish some paperwork, grab a coffee, or even have a nap. This breakdown in communication is nobody's fault. It's just a mismatch between two different communication styles. And that's what the SBAR Plus tool hopes to help with. So what does SBAR Plus stand for? Well, it stands for situation, background, assessment, recommendation, and then asking the question, do I need this patient seen now? Sometimes we can actually have that question up front. Do you need me to see this patient now? Or I need you to see this patient now. I want to return to the previous example where the nurse and physician were communicating about a deteriorating patient, except this time they're going to use the SBAR Plus tool. The nurse starts off by saying, "I have a situation with a 4-year-old who's post-operative with fever and trouble breathing. The background is this child just had surgery yesterday for appendicitis. My assessment is I think he may have pneumonia, and my recommendation is that I think he needs antibiotics. I need you to see him now." To which the physician replies, "I'm on my way." If you haven't seen the SBAR Plus tool before, it looks something like this. At the end of the day, what do I want you to remember about the SBAR Plus tool? Well, firstly, I want you to remember that the SBAR Plus tool helps us all speak the same language. And secondly, good communication saves lives. Our patients do better when we communicate better. I hope you enjoyed this episode of Sketchy EBM. Please do take the time to evaluate, and as always, remember to draw your own conclusions.